you get up?
Yeah, let's get up.
No, I can't.
Okay.
It hurts.
Don't move, okay? Let me go get someone.
Call
Hold on.
somebody.
Caro, why can't I get up?
What are you feeling?
I can't feel my legs at all.
At all? Nothing?
No, nothing. I don't know what's going on.
Oh my
I mean, I
gosh.
just fell and I don't know. Instantly, I couldn't feel anything.
I know that the doctor took some x-rays. I'm sure that he'll be here soon.
Have you called Mom?
Yes, Mom and Dad are on their way.
Are you sure?
Yes.
And the doctor?
He should be here shortly as well.
Oh my God, I don't know what's happening.
Come in. Just here.
Ms. Dominguez?
Hello.
Hi, good afternoon. My name is Dr. Roxy Garcia. I'm going to be the one taking care of you today.
Okay, and are you the one that can tell me about what's going on with me? Because no one's been able to tell me what's happening and I have no feeling in my legs.
Well, yes, Ms. Dominguez, actually I am the one that's going to be taking care of you. So what exactly happened? Can you tell me what happened?
Well, I was
Had
at
an accident?
I was at cheerleading practice and my back spot kind of missed like me when we were dismounting, and I fell to the floor and I fell right on my back and I instantly felt like intense pain, and then right after that I just had no feeling in my legs.
Are you able to find out what happened? Why she can't feel her legs?
Actually, yes. I was reviewing the results for all the exams that we did run on you. According to your x-ray, you do have a fracture to one of your vertebrae.
What does that mean?
Basically what happened is you broke one of the bones in your spine. So because of the severity of the fracture, it did sever your spinal cord, which resulted in you losing function to your legs.
So will I get the feeling back? Am I going to be able to walk again or cheer again?
You know, Ms. Dominguez, in these cases, it's rare that we will get a patient with a severed spinal cord that does regain their function. But I mean, we're gonna be here. We're gonna be working with you. We're gonna help you. So we're gonna try to get you to, the best function that we can get you at. Okay?
So she's never gonna walk again?
I mean, for now, we're just gonna try to see where we can get you. The term is called paraplegia. So basically, what it is.
I know what that is. That means I'm never gonna walk again.
Oh, calm down.
So paraplegia is a medical condition that involves impairment in motor and sensory function of the lower extremities. It's a classification of paralysis that causes loss of movement or sensation following damage to a nerve in the body. It's a type of paralysis that affects all or part of the trunk, legs, and pelvic organs. It's usually the result of a spinal cord injury as a result of an accident or other type of trauma.
Okay, so some signs and symptoms of spinal cord injuries are as follows. So we have loss of function, which would be just being able to walk, being able to go to the restroom, things like that. Why? Due to the fact that, you no longer have control of your lower extremities or even your uppers, depending on where that injury has taken place. So you also have loss of sensation, loss of motor function, you'll have loss of bladder and bowel control. You also might have increased sensation, so like pain sensation. You might have random pains in certain parts of your body, stinging pain. So these are just some of the signs and symptoms, and they all will depend on certain areas and where this lesion occurs or trauma. Osteoporosis can be a factor also.
With a spinal cord injury at the level T12, these patients typically have a little bit more independence. So what they have now is more access to muscles they did not have access to before. Some of these muscles include the intercostals, the long muscles of the back, and the abdominal musculature, especially for those below the level T7. So this being a T12 patient, they will have those muscles available to them. And this is very important for like breathing out, exhalation, that forced exhalation. This muscle is very important for that. And as well as the intercostals help with the breathing patterns in and out, okay? They're also more independent with their activities of daily living, and they have more trunk control and strength, so they're able to do more walking and other activities in bed, out of the bed, in the chair, and whatnot.
Good morning, Ms. Dominguez.
Good morning.
Hi, are you
Hi.
the sister?
Yes, I'm the sister.
Alright. Well, my name is Jasmine Little. I am the PTA that will be working with you today.
Okay.
Alright? How's the meeting today?
Good. I guess I don't feel much of anything. I just feel from here up, but I don't feel pain or anything.
Are you here to help her out?
Yes. Today what we're gonna do is we're just gonna work on some techniques that we can do on your bed, just so you won't be on your back at all the times. You can just, I'm gonna help you roll on your side, and eventually we'll sit you up. So we're just trying to regain as much as independence as we can.
Okay.
Alright? Are you up for that?
Yeah.
Alright, so when you're at home, you can go ahead and help her by just putting this leg on top of the other leg in the direction of that you're going, okay?
Okay.
So here, what you're gonna do is just straighten out your arms up. And what you're gonna do is you're gonna use your upper body strength, and later on we're gonna be working on improving that strength as well. But for now, we're gonna use your momentum. You're gonna swing your arms to roll over facing me, alright?
Okay, so I'm just gonna swing.
Yeah.
Okay.
Just like that.
Awesome, you did it.
Good job.
That part.
Okay, so here what we're gonna do is I'm gonna go ahead and help you. Lift your head up for me. Okay, now bend your elbows and just come up on your elbows. Just like that. Awesome. Okay, now straighten out your elbows. Yeah, straighten out your elbows, coming up to sitting. Awesome, good job. Okay, so now from here, what you can do is with this hand, just grab your pants, but make sure you only grab your pants. Okay, and now push up, pull up, and move it over that other leg. Good job, awesome. So now from here, you can go ahead and use your upper body to go ahead and twist. There you go, and roll over.
Okay, Ms. Dominguez, we're gonna teach you now how to go ahead and go from your bed to the wheelchair using what we call a sliding board.
Okay.
So what I'm gonna have you do first, you're basically gonna be scooting yourself as close as possible to the wheelchair. I'm gonna use this. So for starters, you're gonna go ahead and place your hand here. And what you're gonna try to do is kind of just get on top of the sliding board if you can. Scoot yourself on top of the sliding board. That's very good, just like that, excellent. Now as you get getting closer to over here, just make sure you don't put your fingers under the sliding board. You go ahead and place your hand over here, and then you try to scoot your way more over here, closer to the wheelchair.
I'm a little scared.
That's okay, I'm right here, nothing's gonna happen. Alright, very good, and then just keep going until you're at the very end. Just make sure you don't put your fingers under the sliding board, okay? Just keep scooting yourself over. You can go ahead and grab yourself from there if you like. Alright, very good. And then just keep scooting yourself. Alright, got you. Okay, and once you're there, you could actually, since you're already on the wheelchair, you can actually move your body towards that way to take some of the weight off, and then you could actually just pull out the sliding board. Do you think you'd do that? Alright, very good. So now once you're on the wheelchair, just make sure you have your pelvis all the way to the back of the wheelchair, okay?
How do I do that?
You could actually grab yourself from here, and you can grab onto the wheelchair for now since we took off the row, and then just push yourself all the way back. There you go, just making sure you're all the way back in the wheelchair. You did very good.
Cool.
Okay, hi Ms. Dominguez. So I'm going to be showing you today just how to do a wheelie with your wheelchair. And basically what it's going to help you with is being able to go up curbs when there's not a ramp, to even go upstairs. It takes a lot of strength, but it's actually possible, so if you could progress to that point.
Okay.
And also just clear any little obstacles that might be in your way, little bumps or whatever.
Okay.
Okay? So basically, of course, you're not able to use your legs, so you just have to grab your wheels, and you're gonna lean back like that. Now when you do that, you have to learn to find your center of balance. And if you're gonna move forward, if you feel like you're gonna move forward, you roll forward. If you feel like you're gonna move back, you roll back.
Okay.
So it's that simple. And then when you wanna turn, you can do this. So you kinda keep one arm stationary and the other one turning you.
Okay.
Right? So
I think we should start with the balance.
yeah. Well, I'm just showing you how we can go ahead and do all these different things, and you could even become really good, like to do things that I can't do. But so it's as simple as just you lean back and you're gonna hold yourself there. So I'm gonna have you do that, and I'm gonna help you. Okay?